So this video will talk about men with the lower urinary tract symptoms, or LUTS. So at the initial assessment with these men, general medical history should be taken to identify possible causes for LUTS and associated comorbidities. We need to review the current medication, including herbal and over-the-counter medicines, to identify drugs that may be contributing to the problem. You always offer physical examination, obviously guided by urological symptoms, examining the abdomen and external genitalia and a DRE. You need to offer men a urine dipstick to detect any blood, glucose, protein, leukocytes and nitrites. And also you need to give reassurance, advice on lifestyle interventions, for example fluid intake, and information on the condition of LUTS, and especially to those whose LUTS are bothersome or complicated. And also you need to check PSA, especially in few categories. These include if the LUTS are suggestive of bladder outlet obstruction secondary to BPE, or the prostate feels abnormal on DRE, or if they are concerned about prostate cancer. You need to ask men to complete a frequency volume chart, which is a recording of how much they drink, how much they pass urine, and if they have any leaking episodes. And also you need to assess their baseline symptoms with a validated symptom score or questionnaire. The most commonly used one is IPSS questionnaire, so to allow assessment of subsequent symptom change. If you suspect renal impairments, you need to check serum creatinine, and usually if the man has a palpable bladder, if there's a history of nocturnal enuresis, recurrent UTIs, or history of renal stones. So in those cases, renal impairment could be suspected and is justified to check the creatinine. Do not routinely offer cystoscopy. Do not routinely offer ultrasound scan. Do not routinely offer flow rate and possible residual assessment in the initial assessment if there are no complicating factors. Now, in terms of the when to refer to specialists, there are 6 indications that you need to abide by to refer to specialists, and these are those men who have LUTS complicated by recurrent or persistent urinary tract infection. Number 2, retention. Number 3, renal impairment that is suspected to be caused by lower urinary tract dysfunction, or if you suspect urological cancer. And the 6th one is if you suspect stress urinary incontinence. So what do we do different in the specialist assessment? Is very similar to the initial assessment. So as urologist, we also take a medical history, any comorbidities, we review the medication, and also we offer physical examination, including abdomen, external genitalia, and DRE. And we ask the men to complete a frequency volume chart. And also we check the PSA as before if their symptoms are suggestive of bladder outlet obstruction, or prostate feels abnormal, or the person or the patient is concerned about prostate cancer. We need to offer them flow test and post-void scan. And also we need to offer cystoscopy if there are any red flags, and these include recurrent infections, sterile pyuria, hematuria, profound symptoms, and pain. You need to offer ultrasounds of the upper tracts, fairly similar indications which include chronic retention, hematuria, recurrent infection, sterile pyuria, profound symptoms and pain. You can offer urodynamics to any men you are considering surgery on. You won't be criticized for offering that. You can offer pad tests as well, if the degree of incontinence need to be measured to those who have incontinence. Thank you.